Hello, my name's Dr. Alan Hakim and I'm one of the leads for EDS ECHO.
And I'm Claire Francomano, also one of the leads for EDS ECHO.
So it's been 3.5 years since we actually started EDS ECHO. Do you remember what the early days back in April of 2019, I think?
Yep, I remember going to New Mexico and learning all about ECHO, the ECHO program itself, from the mothership.
Right. I mean, incredible the work that they were doing, and I was just enthused by it, just that we have to do this, but not just at a kind of national level, but internationally. And EDS and HSD was perfect, right? The first rare diseases ECHO.
Absolutely, and the idea of bringing this information to the providers worldwide was just really so inspirational. Bringing the information to the patients so they're not geographically limited in terms of access to the care. That was really one of the major motivations for us.
So Claire and I started with a clinicians program where we had a number of speakers and participants, and that clinicians program has just grown and grown, hasn't it? And we've since introduced one in New Zealand, and we also now have one in Spanish, which is run out of Mexico. Great fun running the clinicians programs.
It really has been, and one of the things I really love is the new program that we introduced just this year to do the catch-up, so people can drop in and discuss their really challenging cases and learn from the participants. That all teach, all learn is really a key element of the program.
Absolutely, and we have, people from all sorts of different disciplines, and that really enhances the conversation.
It certainly does.
Yeah. No, the drop-ins have been amazing, but the feedback across all of the programs has been incredible, I think.
Yeah, it's really been very gratifying, and I think the fact now that we have so many new programs, we started with the clinicians, but now we also have the allied health professions, we've got the pediatric program, there's an orthopedics one that's starting up, so I've probably forgotten one.
Well, it's grown from strength to strength. So we have the pediatrics, which is out of North America and also out of Australasia. The allied health professionals, North America, Europe and Australasia. We had a vascular group, which now do an annual conference. It just grows from strength to strength. But the one thing that we introduced, which had never been done before in an ECHO model, was the community model. Started off with advocacy and then moved on to leaders in education and support in the community, and that's been incredibly successful too. So we've been able to be innovative at the same time as following the ECHO model, and it's been great to be part of that.
You know, the other thing that I think is worth mentioning are the day-long conferences that we've had under ECHO, which have been so useful in bringing a really concentrated bit of information to professionals, providing CME for them.
Yep.
And so we've had the pain one, the mast cell activation, mast cell biology. I think there's been another.
There's been several. One that you've forgotten, and I will always be grateful for your idea behind this, was that we set up that 2-day conference to review many of the comorbid issues in EDS and HSD. And of course that then led to those reviews and the scientific publications from that, all coming out in the American Journal of Medical Genetics, December 2021, which, myself with the Ehlers-Danlos Society, we spearheaded the event. You came up with the great idea of getting it all rewritten and published, and then you and I, with Brad Tinkle, ended up as the guest editors to get it out there, and I think it's that's been incredibly empowering for me to learn all of that from all of these amazing experts that take part.
Yeah, it's really been an educational process for all of us.
We shouldn't forget the fact that this has been funded by an incredibly generous benefactor. And as we move forward, we will need to continue looking for funding, because we do try and provide everything for free.
Yes.
And so we'll continue that work. But as we move into 2023, more programs, we want to do more of the ECHO one-day conferences. And we're really interested in introducing any additional programs. So if anybody has any ideas that they were interested in, then we're asking them. And I think that one that is hopefully something that we can introduce next year is one on genetics and genomics. on a regular basis.
Yes, Dr. Ermine Fergani has suggested that, and I think it's a fabulous idea because there are so many issues around the genetics and genomics and the interpretation of variants of uncertain significance.
Yeah.
And so to bring that all teach, all learn approach to that conundrum,
Amazing.
I think would be really, really helpful.
And I'm working closely at the moment with several of the working groups from the International Consortium to see if they can either embed themselves into some of our programs or even have their own programs. So, for example, I'm talking with the nutrition team at the moment to see if we can bring that, sort of elevate that more to the front line, if you like, of our conversations. And I'm really keen to introduce some more other language programs.
Yes.
I really hope maybe we can bring one in German and possibly French, but the Spanish one we want to extend and really encourage everybody to attend those next year.
It's been a great pleasure doing this with you,
It's
Alan.
been fabulous working with you. It's been great fun, and I'm really looking forward to another great year.
Yes, as am I.